today's virtual briefing, assessing COVID economic relief, what has worked and what's next. I'm Pia Arrhenius. I'm Vice President and Senior Economist at the Federal Reserve Bank of Dallas, and I'm really delighted to serve as the moderator today of this event. Today's event is sponsored by Population Association of America with the support from the Association of Population Centers. And as many of you know, PA is a professional association comprised of over 3,000 population scientists, including demographers, sociologists, and economists, who are conducting research really on individual, social, environmental implications of human population change. Population scientists, including today's panelists, rely on funding from the nation's scientific research agencies, especially the National Institutes of Health and the National Science Foundation, to support their research. Of course, they also rely on data produced by the federal statistical agencies to inform their interdisciplinary and policy relevant research activities. So the research featured today in our briefing really underscores the integral role that federal scientific and statistical agencies play in the field of population research and the importance of good and timely data. The topic of today's briefing is a great illustration really of how the population scientists in our community play their role that they play in addressing policy issues that affect us all. The pandemic obviously had substantial effects on the economy, caused widespread instability, both across markets and for individuals and families. And as population scientists, we have been squarely engaged in the discussion around the what happened in the pandemic and the outcomes of individuals and families, studying the short and long run implications of these of what happened in the pandemic recession on the health and development and well-being of communities. So our panel of experts today is going to present findings illuminating certain policies and programs such as cash transfers and child tax credits. And we'll talk about how they've affected really the post-pandemic economy and the labor force. And they will also highlight really what questions remain as we continue to recover from the pandemic. So we have really excited three great distinguished scientists and scholars presenting today. And so we'll start with Marianne Bittler at the University of California at Davis, and then followed by Greg Duncan and Kristen Harknett of respectively UC Irvine and the University of California, San Francisco. I'm not going to read their bios. They're in the chat. Links to the bios are in the chat, so you can find them there. And so we'll start soon. A few housekeeping matters. So just for your awareness, speakers are not here really to advocate for specific policies, and certainly any positions they may express don't reflect any positions of the PA or the APC. And of course, we'll make the speaker slides and bios, and a recording of this webinar will be made available to you. It'll be posted on the PAA homepage after the event today, but also if you registered for this event, you'll receive a link to that information. Each speaker will talk for 12 minutes, and I may give a brief response to the presentations at the very end, but really we do want to get to your questions. So if you have questions, please post them at any time in the chat box, and I'll relay those to the speakers, and we'll have a great discussion. So that's it for the introductory remarks, and I'll turn it over to you, Marianne.
There we go. You'd think I'd know how to use Zoom by now. Okay. So I'm going to talk about the role of the safety net during COVID. I'm going to start off with some background on the public safety net in the US. So currently we have a patchwork safety net with a wide range of safety net programs and social insurance programs. And these programs serve two purposes, particularly the safety net ones. First, they provide a floor for people's consumption who are eligible for the programs. And secondly, they provide a stabilizer during downturns. Many of these are entitlement programs. So when more people become eligible and apply, more people can get onto the programs. And our federalized system means that these programs vary considerably across locations. And another important thing that's happened over the last 20 years or so is these reforms have made our safety net more in work and less out of work. So many of the programs are associated with working. The lack of integration of these programs and data and the need for people to apply to get them is different from many other OECD countries where the government would figure out if you were entitled to get a particular program and provide you benefits. And the Great Recession and more recently COVID have stressed our system. So as I said, the US has moved towards a work-based safety net and away from an out-of-work safety net since the mid-90s. The ITC has been expanded greatly, and it's increased labor force participation for some and had shown to have positive effects for kids and moms. But TANF is now a block grant. It used to be the AFDC program. It's largely repurposed for states' preferred in-kind spending, and it's fixed in nominal terms. The food stamps program remains the main unconditional program that we have left. And in the background, important in downturns is unemployment insurance, which is run by the states. So one might wonder if these programs are adequate. Maybe they're not at the very bottom, and certainly not all of them are responsive to shocks. So I'm going to tell you a little bit about stuff from my own research and other people's research about what does this mean when crisis hits, a little bit of what we might have expected based on evidence from the Great Recession, and then what actually happened during COVID. So in the US safety net, it's a bit less generous and less comprehensive than the safety nets of other OECD countries. So we spend a bit less on as a share of GDP than other OECD countries. And it's a mix of various means tested in other programs. Some programs provide cash and others provide in-kind benefits some of which are closer to cash and some of which are further. Additionally, we have some programs that work through tax expenditures, importantly, the Earned Income Tax Credit and the Child Tax Credit, rather than transfers. And in part, this is for political economy reasons. So some key features of our system is that some subnational governments like states or counties or even cities and towns and non-governmental local actors like schools and clinics run these programs. There are some challenges with having centralized data on income and programs. And so it's hard to determine eligibility or even make payments to everyone federally. And this became clear during COVID when the EIPs were paid out. If Treasury had information on you, they could send it to you direct deposit, but some people who hadn't filed taxes recently, they didn't have information for, and those people had to apply. And everybody has to apply for most of these programs. And when you apply, it's not even a uniform concept of income or family or children that matters for applying for these programs. Different programs have different levels of administrative burden and difficulties involved in the eligibility process. And there are lots of, because these programs are set up not consistently across all of them, there can be places when marginal tax rates change a lot. Some of the programs are explicitly not countercyclical, which means that they are not going to be very good at responding to downturns. So for example, the Earned Income Tax Credit, you qualify during a year in which you're working, and then you get benefits the following year when you file your taxes. So if you hit an economic downturn this year, you may fall out of eligibility for the program. And if you become eligible for the program, you won't get any of that money until next time. Furthermore, block grants can't change quickly. Okay, so pros and cons of this system. Some pros are the states and localities are closer to the ground, and sometimes they can make better choices that are reflecting local needs, but they also may have different goals than the federal government. And data acquisition and bureaucracy and the ease and costs of eligibility determination vary widely across locations, in part due to capacity constraints, in part due to other forces. So first, I'm going to mention a little bit based on some research with John Iselin and Hilary Hoynes about what happened in the Great Recession. We provided this in a paper before, very close to when COVID started, to try to have some sense of what we would expect in terms of the responsiveness of existing programs. So we combined administrative data on people and spending with population counts at the state level from 2000 through as close to COVID as we could get. And we looked at responsiveness to the shock using measures of state by year unemployment rates as the measure of the shock, and then controlled for national shocks and time invariant characteristics across states. And not so surprisingly, we found that the unemployment insurance program was the most responsive, and then SNAP was the next most responsive. And AFDC, TANF isn't responsive anymore, which makes sense because it's a block grant. Overall, we found that the means tested programs provided less spending per capita than the social insurance programs. And that makes sense because the social insurance programs are more generous. So then during the COVID era, I'm going to tell you a little bit about what I found in some work with Hilary Hoynes and Diane Schanzenbach and the Brookings papers and a forthcoming paper in the Russell Sage Journal and some other people's work. We combined survey data from the current population survey and the census pulse, which provided some real-time data that otherwise would have been unavailable during COVID. And we used a variety of administrative data sets, including the Treasury statements and USDA data on SNAP caseloads and disbursements and some DOL data for UI. And most of the focus of this work was on UI, SNAP, and the economic impact payments and the child tax credit. So for UI, some of the reforms during COVID were the top up, additional federally funded weeks if other weeks are used up, and then this new program which provided UI for self-employed and new workers who would have been ineligible normally. SNAP's reform was to pay everybody the max payment available, and there were some other administrative reforms to make it easier for people to get benefits without having to go to the office. And then the EIPs paid out at 3 different points in time. This is when they started paying out, and the child tax credit was quite generous. And furthermore, about half of the child tax credit for that year was sent out monthly during July through December of 2021. So we all know this, but this is just reminding you that the shock was massive. This is showing race ethnic unemployment rates from the current population survey. You see this enormous effect of COVID, and then you can also see there was some variation by race ethnicity, with Blacks and Hispanics being harder hit at the beginning and at points throughout. This next chart shows hardship through looking at annual food insecurity. This is for children in 2019 in the left bars, and then 2020 in the right bars. And you can see this increase in food insecurity for children across time. And you can also see that the increase was worse for Blacks and Hispanics. This next chart shows you how massive this response was of our government. So the government spent an enormous amount on all of these programs over time. So around, this is from the monthly Treasury statements. It's new spending relative to the previous year. So, you know, it nets out normal spending on UI and SNAP, obviously the EIPs and the new child tax credit, are de novo programs, and you can sort of see the EIPs are quite large. So that's the green bars that are under the lowest part of each of these bars. And you can see that there was also increased SNAP spending, and particularly in 2021 when it was available, the child tax credit. So at the same time, there was a lot of need as there was a lot of spending. And so in our work, we tried to understand why there was so much need early despite so much spending. And there were 3 main reasons. First of all, there was timing. New programs take time to ramp up. And the government doesn't always have all the information it would need to send payments out right away. And there was some amount of starting and stopping of payments. The magnitudes varied over time and across programs. And the programs are incomplete. There were holes in eligibility for the programs. Some groups are not eligible for these programs, and in take-up. So in terms of these delays in payments, first of all, the states had to ramp up new programs while there was enormous need, and some states had reduced the generosity of their UI systems and changed their application processes. UI is usually very countercyclical. And therefore, states aren't necessarily staffed up for excess demand in usual recessions, much less during COVID, where the recession happened so quickly. And then there were some issues about implementing the new programs and administrative burden. There's incomplete access. So first of all, the first EIP excluded households with adult non-citizens and some young adults. And the UI program intentionally doesn't cover everyone. So you need sufficient work history and wage and salary earnings and covered work. And this is the thing that was loosened up during COVID, in the dark blue. So even in good time, even in normal times, not everybody who is eligible for the UI program gets it. Okay. And not all the relief spending was targeted to the shock. So this chart shows spending per county, per capita, on the y-axis. This is the change in SNAP benefits from January 2020 to January 2021. And the x-axis shows the employment shock. So a bigger negative number means a negative employment shock. And this is not what we would have necessarily expected. This suggests that there's a positive relationship between job changes and SNAP benefits, whereas you might have expected a negative relationship if they were being targeted to the places that had the biggest job losses. So I'll just conclude by saying, okay, then I don't have to go quickly. I will conclude by saying our safety net is not currently designed for economic downturns for the poor. We've had this big shift over 25 years to a work-based safety net, which boosts low earnings, but doesn't have very big out-of-work payments, and there's no insurance against job loss. UI coverage rates and insurance value are differing across states and can be low in some places. This map to the right shows the replacement ratio amongst eligible workers, and UI provides the most income replacement, but the lowest income folks are getting the least support. And I will stop here. Thank you very much.
Thank you, Marion. We'll go to you, Greg. How might children have benefited from the American Rescue Plan's refundable child tax credit?
Thank you. Thanks everybody for joining in on this webinar. I want to just begin with the good news that the Census Bureau released a couple weeks ago, where they estimated that poverty rates for children fell by 50%. This is using the supplemental poverty measure, which includes non-cash benefits like tax credits. And when you add in those kind of benefits, you get this pretty dramatic drop, 50%. It was dramatic across all demographic groups, as you can see here. But it also continued this downward trend that began in about 2017. So this is very good news. It was not unexpected. The National Academy of Sciences produced a report called A Roadmap to Reducing Child Poverty, where it provided simulated estimates of what would happen if the government adopted various policies. And one of them was a $3,000 per year refundable child tax credit, which turned out to be a prominent part of the American Rescue Plan. It was $3,000 for kids older than 6 and $3,600 for kids under 6. And that was simulated to reduce poverty by 40%. So we knew that something dramatic was going to happen. It's also going to be equally dramatic when we look at poverty rates changing between 2021 and 2022, because this child tax credit component is no longer in effect. These kind of forecasting exercises are very helpful. But population scientists really want to go beyond this kind of forecasting and description to understand the consequences of policies like this. And in this case, the consequences of policies like the extension of the child tax credit for children's healthy development. So that brings me to describe a project that I've been associated with called Baby's First Years, which is a randomized control trial of poverty reduction in early childhood. There's a big cast of characters. We began planning this in 2011. You can see the PIs on the study. We've had many wonderful funders. NICHD has been a primary funder for us. OPRE as well, and many private foundations and philanthropists have kicked in to help support the study. So we're grateful for all of that. The design is very simple. We recruited 1,000 low-income mothers in birth hospitals in 4 different cities, chosen to be geographically diverse in terms of safety net benefits. And when mothers consented to be part of the study, we gave them a debit card loaded up with one of 2 amounts. determined randomly. One group started getting $333 a month for what will end up being 6 years. And the other group did receive deposits on the card, but it was $20 a month. So you had this contrast between $4,000 a year and $240 a year between the two groups of mothers. And we've done interviews with the mothers when their kids were 1 year of age, 2 years of age, 3 years of age, and now we're doing a age 4 follow-up. I want to point out some similarities, but also some differences between our payment scheme and the refundable child tax credit that was part of the American Rescue Plan. The difference between the two groups, the 4,000 versus 240, is almost exactly the payment that was extended to children under the age of 6 during the American Rescue Plan. Both were paid monthly. Actually, the American Rescue Plan paid half of the benefits monthly and then half the benefits in lump sum, but the total amount of money was very similar. A big difference was our payments are just for one child or for the family on behalf of one child, whereas the American Rescue Plan paid this $3,000 or $3,600 per child for all the children in the household, right? So there was a lot more paid out to families with multiple kids than we're paying out to families with multiple kids. The other difference, which is kind of interesting, is the branding difference. How mothers perceive these payments may depend upon the way in which the payments are received. American Rescue Plan, it was a child tax credit. The messaging was not crystal clear for us. We handed them this debit card in the hospital and it said, "For my baby," right? So if you believe people do mental accounting with money, it might have led to more expenditures on behalf of kids than might be the case with government payments. Our research questions are very simple. First, do these payment differences support children's healthy development and brain function? That was kind of the bottom line. What are the implications of a program like this for children's healthy development? The second question, to the extent that kids are showing changes, why did they come about? Was it something in the way that the family was functioning? We have a theoretical model where there's a kind of investment pathway. It's what parents spend with the money. There's a stress pathway, which argues that reducing poverty will reduce stress and improve parenting and thereby improve child outcomes. So we followed these kind of theoretical models in selecting measures that we included in our age 1, age 2, age 3, and so forth interviews. The most interesting results we have so far were from EEG measurement that we took when infants were at the age 1 visit. Kids were 12 months of age. We did an in-person visit to the 1,000 families. And the interviewers, this was quite innovative. It was technology that just became available. Interviewers were able to take into the household these portable EEG machines, and they would put these caps. You can see a child with a little cap on. Ours had 20 electrodes, and every one of the electrodes would be recording brain activity in the form of electrical activity. So you can take those data and massage them and come up with measures of brain activity between the kids in the high cash group and the low cash group. We published our findings in the Proceedings of the National Academy of Sciences in February of this year. And these are not totally definitive in terms of statistical significance, but it's close, and there's a lot of ancillary evidence kind of supporting that there are these differences. The two portions of the frequency spectrum that correlate most with later cognitive development for kids are the beta and gamma portions. And as you can see in these heat maps, there were significant differences, more activity going on in both portions of the spectrum for the high cash group and the low cash group. So very intriguing. 12 months. We're, as I will explain, about to do a age 4 follow-up where we're going to redo this, replicate this, and see if it holds up. Other early findings from the study relate to these kind of pathways that I described. The investment pathway, whether the parents are using the money to buy enrichment kind of expenditures for their kids, that is supported substantially, not only in the first year, but more recently in the follow-up ways. Families that are getting the $4,000 a year are spending about $750 more on their kids. Things like books and toys. We have an inventory of child-related expenditures. We also have questions about how much time they're spending each week, reading to the child, telling stories to the child, and so forth. And that's a consistent, significant difference between the high cash group and the low cash group. So families do seem to be taking this higher cash amount and translating it into more expenditures and more time with their infants and toddlers. On the other hand, we have found no group differences in terms of employment. We've got a paper that we're hoping to post pretty soon about that. We have a paper looking at the kind of stories that when parents receive these kind of benefits, they spend it on temptation goods, alcohol, tobacco, opioids, things like that. We have a paper showing there's no evidence supporting that at all. But the real surprise is that we took many measures of mental health of the mothers, depression, anxiety, parenting stress, a general kind of economic stress, and we're not finding any differences between the high cash group and the low cash group in terms of mental health. So quite a bit of support for this investment pathway, but so far no support for the stress pathway. So stay tuned, as I say, we're just a few months into our age 4 data collection. Kids are coming into labs that we have set up, university labs set up in the 4 different sites. We're getting EEG measured again, conventional kind of cognitive assessments, IQ and so forth. Socio-emotional development, we're doing a physiological measure of stress with both the mother and the child. And then we're videotaping a parent-child interaction to try to understand whether there are differences in the sensitivity of interactions between the 2 groups. So we're 150 out of the 1,000 so far. We'll keep going on until next July. So stay tuned. We're very excited to see what the results are.
30
Thank
seconds, Greg?
I'm sorry? I'm finishing up now.
30 seconds, super.
Yeah, okay. I told you I was ahead of time, Will. So this is the website. The papers are there, all the information, all the documentation. So take a look if you're interested. Thank you.
Thank you, Greg. Next, we'll turn to Kristen, and she'll speak about precarious work in the U.S. service sector.
Thank you. So I'm really pleased to have this opportunity to share some findings from the SHIFT project, a federally funded study, which I co-direct with Danny Schneider. The SHIFT project focuses on job conditions in the service sector, and in particular on workers who are paid by the hour, who are working for retail and food service employers. To set the stage a bit, the service sector is large and growing. Over 25 million workers are employed in retail, food service, or hospitality, and that's 17% of the entire US labor force. And it's worth noting that during the pandemic, while many people were working from home and limiting their exposure, these workers continued to report to work and were really essential for meeting our basic needs, providing food through grocery stores, medicine at the pharmacy, and other necessities for the public. Yet these service sector jobs are often quite bad jobs in terms of their job quality, characterized by low wages, few benefits, underemployment, volatile work schedules, and volatile earnings. And workers in the service sector report a striking amount of economic insecurity. Right before the pandemic, over 40% of these workers reported that they would not be able to cope with a $400 expense shock. Almost 1/4 said they had a very difficult time paying their bills in the prior month, and more than 1/4 reported experiencing hunger hardship in the prior year. Now, these workers have enjoyed some gains in terms of hourly wages, shown on the left, but these gains are offset in part by a decline in weekly work hours on the right. But what's really been under the radar and underappreciated is the rampant instability in work schedules in the service sector. We've just not had a lot of data on this, but anecdotally, workers' stories suggest that this is a big deal. So one worker we spoke with in an in-depth interview, Robert, a working father employed in fast food, described how his unpredictable schedule had widespread negative consequences. He talks about how the store needs dictated his hours and how a lack of control and instability in his schedule spilled over in a pervasive manner, affecting his sleep, his diet, and his time with his family. He laments not having time for his kids or for his wife. The SHIFT project has set out to collect systematic large-scale survey data from service sector workers like Robert at large named employers since 2016. And we've now amassed survey responses from about 165,000 workers employed at around 145 large companies. And we've aimed to fill a number of gaps in data on job conditions and how they vary across companies and different labor policy settings. And one focus has been on documenting work schedule conditions to see how common stories like Robert's are in the broader service sector. And we found that unpredictable and unstable schedules are really common. 2/3 of service sector workers report last-minute changes to their work schedules. 1/4 of these workers report being asked to be on call for work. And if they're not called in, they're usually not paid anything. 70% of these workers report that they have to keep their schedules open and available for work at any time. And this is not what most workers want. 72% of workers report that they want more stability and more predictability in their schedule. Now, these unpredictable schedules are not inevitable. There is wide variation across companies in these practices. So looking across all the companies represented in our data, some always assign schedules on short notice, while others almost never do. And even if we look at a set of companies within the same sector, general merchandise, we see wide variations. So assigning schedules on short notice is a company choice, and some companies choose to offer more notice and more predictability. Now, a handful of cities and one state have taken some policy action to provide workers with more predictable schedules. And one of these cities is Seattle, which passed the Secure Scheduling Ordinance a few years back. Seattle's ordinance requires large retail and fast food employers to provide workers with 2 weeks of advance notice and to compensate workers when schedules are assigned or changed on short notice. Our evaluation of Seattle's legislation showed that it moved the needle on reining in unstable schedules. The legislation increased schedule notice and reduced last-minute changes without pay. And these changes to schedules also led to improvements in worker well-being. Seattle workers experienced improvements in their sleep quality and reductions in their economic hardships after the law was passed. Legislation to require schedule notice and pay for last-minute changes has been introduced at the federal level through the Schedules That Work Act. But currently, these types of schedule regulations are the exception rather than the rule, in effect in just a small handful of locations. And overall, the majority of service sector workers continue to experience last-minute changes to their schedules and schedules that are assigned with little notice. I'll briefly touch on one other policy area of enormous importance during the pandemic, and that is paid sick leave in the service sector. Now, it's important to keep in mind that service sector workplaces are high traffic, and even during a pandemic surge, people continue to go to the grocery store and the pharmacy. So this is a place where working while sick has dramatic public health consequences. So with that in mind, it's alarming to note that the majority of service sector workers do not have paid sick leave, putting them in a very difficult position of having to go to work even when sick.
Unemployment benefits really were across states, given the different replacement ratios. Well, I think we're out of time, so I just want to really thank you all, Greg and Marion and Kristen, and what a wonderful webinar, and thank you to PAA for organizing, and thank you to all of the listeners and everybody who tuned in. And so PAA will send you a link to the recording of this event, and also to the bio, so you can read about our amazing speakers, and also to the presentation, so that you want further information. Just thanks for attending, and have a great weekend.